Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and thanks for joining me back in the Sunflower House. Today's episode is dedicated to fathers and everyone who loves fathers, and it is on the topic of the latest treatments for hair loss, hair thinning, and alopecia, which is the medical term for hair loss. In our first season, last year on Father's Day, that was the all-time most favorite listened to podcast on Speaking of Women's Health. And as you know, this is not medical advice, but it is to empower our listeners to be strong, be healthy, and be in charge. And every Father's Day seems to take on more meaning for me personally, because as the older I get, the more terrific fathers and father-like figures and mentors that I get to know. And this Father's Day, both of my older two sons, Stetson and Emerson. Stetson's the father of Artemis and Beatrice, and Emerson is the father of Lincoln. And my fourth son, who's really my nephew, but he feels like my fourth son, Keaton, who just had his 25th birthday. Happy birthday, Keaton. So successful, a college graduate with honors in mechanical engineering, running his own business, is married and helping to raise his wife's older daughter, Sadie. Well, they just found out that they were expecting, and actually it's been a little while ago, but they had the gender reveal with a golf ball that was blue. So exciting because I love golf. And so that baby boy is expected in August. So my maiden name is Hales. He's Keaton Hales. So this child will take on the Hales name legacy, just like Lincoln will be carrying on the Thacker name legacy. So as I said, Father's Day is a time to celebrate dads everywhere and any male relative or friend who helps to raise the next generation. One of the common issues that so many males experience, particularly with age, is male patterned alopecia. And as I said, alopecia is the medical term for hair loss. The term androgenic alopecia means it's driven by androgens. Now, we women, just like men, have androgens and testosterone. We actually have more testosterone gram per gram than estrogen. It's just that men have 10 times the amount of testosterone we have, and during the reproductive menstrual phases, and certainly during pregnancy, we have way more estrogen than a man has. But at the time of midlife, once those eggs are gone, there's no more production of estrogen. And a woman has less estrogen than an older man. And that's why so many women at midlife, especially if they're genetically predisposed to this androgenic alopecia, start noticing hair thinning right here at the temples or right here on the top of the head. And so this not only occurs in our brothers and fathers and uncles and grandfathers and nephews and sons, but it can also occur in genetically susceptible females. So instead of calling it male pattern hair thinning, of course we wouldn't do that. We call it female patterned hair thinning. And it's the exact same physiologic process that the normal human androgen hormones that are made in the adrenal glands and also in the ovaries in females and quite a bit in the testes in males. And it acts on those hair follicles that are genetically susceptible. And like I mentioned, that's temporal area, usually the top of the head, or can be this whole area. So eyebrows are not genetically susceptible. Underarm hair, chest hair in men, pubic hair. But it's hair that is sensitized, just like there can be hair follicles on the face and chin that are very sensitive to growing when exposed to testosterone as opposed to losing hair. And that's why many men have beards and mustaches if they choose to grow it. Women generally do not like growing beards or mustaches. And some of this is genetically driven. Some of it can be pathological if there are ovarian or adrenal tumors that are making too much androgens. And certainly anytime that there's an imbalance in the hormones. Now, the one good thing, luckily, ladies, is we don't generally at all become bald like many, but not all men do from this androgenic hair thinning. But women can lose hair, particularly when they're stressed, when they've lost their estrogen at midlife, if they're not taking hormone therapy, or it can even start to happen in perimenopause when there's dips in the hormone levels and eventually absence of estrogen, which is made exclusively in the oocyte, the ovaries, the eggs. Now, if you did not get a chance to listen to me podcasting my updated version of the Cleveland Clinic Guide to Menopause, I go into a lot about the physiology, the factors that affect the hormones, what the hormones themselves do, how we try to separate hormonal aging from just chronologic aging. And speaking of chronologic aging, most women will see some hair thinning with age. And for centuries, long, plush, shiny hair has been quite the female hallmark. And I think that there's a variety of personalities and skill sets and physical phenotypes. It seems like that females, some females more so than others, seem very attuned to hair. Like my granddaughter Artemis, who from a really young age commented and seemed quite aware of hair quantity, hair length, hairstyle, hair color. And I was not one of those girls. And as I've told you in some of my other podcasts, I was more of a nails type of girl instead of hair. However, after I became a physician and saw so many women come to me distressed about their hair, which was so perplexing to me because being an board certified internal medicine specialist, a menopause specialist, an osteoporosis specialist, someone who had cross-trained in multiple different disciplines, including hormones and endocrinology and gynecology, as well as aging. It just shocked me that people would come to me for what really I just thought was cosmesis. Like I thought, oh, why not go to a dermatologist? And after seeing several patients and seeing how affected they were by this and how they intuitively knew that at least on some level for some of the hair loss, not all, some hair loss can be from chemo. It can be from, which is, thankfully reversible. It can be from autoimmune conditions, can be from scarring conditions. So not all of it's hormonal. And some of it is telogen effluvium, which is just an acceleration of just the normal shedding phases of the hair. And that can happen after anesthesia, after childbirth, with any nutritional problems. And you can have 2 or 3 causes of hair thinning as well. So for whatever the reason of the cause of the hair loss is, if it induces panic, which it doesn't in all women. I've seen some women with significant hair thinning who don't even seem bothered or concerned by it. And certainly we don't want to make anyone feel self-conscious. Some of us just are not hair people. Other people, are somewhat concerned, but not that much. And for others, it's really, really a core part of their identity. And of course, I don't know how things are going to be when Artemis grows up. She says she wants to be a doctor like her Mimi. And So I'm sure over time things will change, but now she's very interested in her clip-on hair extensions. She's very interested in seeing how long and thick her hair grows. And I don't know if it was that early minoxidil exposure she got as a child. I think I told this story in last year's hair podcast. Um, but I had given my oldest son, Stetson, who started to get a little bit of male pattern hair thinning at the top of his head, some Rogaine. And so, he's dutifully putting it on his scalp at night because if you do that for 6 months, whether you're a male or female, it generally does grow hair. And his daughter, even at a young age, liked to twirl hair. And she didn't have very much hair as a baby, but she could twirl other people's hair. And she liked to suck her 2 sucking fingers. And when I was giving her a bath one evening, I noticed a little tuft of hair at the base of her spine. And I was very concerned about spina bifida occulta, which can cause a tethered spinal cord. And my son was kind of a little irritable at me because he said, "Why were you giving her a bath? I didn't say to give her a bath." I'm like, "Well, I thought she needed a bath and it relaxed her. And oh, by the way, I've seen this concerning tuft of hair." And he just kind of blew it off. "Oh, it's just familial." I'm like, "No, it's not. This is not normal." And he started looking at her and saying, "Well, look, she's got some hair here on her shoulder." It was light colored. Hair here, hair, some fine hair everywhere. And he started looking things up and he said, "Oh, she's ingesting the Rogaine, twirling my hair and sucking her fingers." And sure enough, over time, he immediately stopped putting Rogaine on his hair. And she still likes to twirl his hair. She tells me how she loves to twirl my hair. And she even loves to twirl my husband, Tom, her sir's hair, even though it's not that much hair. And some of it has some nice gel on it. So she really finds it quite soothing to do that. And we do like soothing, relaxing activities. And that's one of the first things I tell women who are so distressed when they tell me that they notice increased shedding, is that if you're stressed and panicked, those stress hormones made in the adrenal glands worsen the hair shedding, which in turn worsens the panic. So it's a vicious cycle. And if you haven't listened to my podcast on how anxiety ages you and some of our other offerings on how to reduce stress, I think that's very important. So it is key that we do our best to control stress and anxiety. And I tell women, if you need to worry, you worry for 10 minutes in the morning, and that's it. And then you cut it off and go about your day, and don't let these intrusive thoughts cloud your mind. And complete hair loss, which is termed alopecia totalis, an autoimmune condition, is very rare. And those persons can lose all the hair on their head, their eyebrows, eyelashes, and complete body hair. So it's not just the androgen sensitive hair. And just like so many things change with age in our bodies, most women are going to note thinner hair with age. I was looking at some home videos of when I was a young mother with my 2 sons. And even though I've never really had thick hair, I was like shocked looking at the videos. Oh my goodness, my hair was so much thicker than it is now. So I think a good expectation is that 40% of women will lose about 40% of their hair. Now, our guest podcaster, Sylvia Morrison, who's done some great podcasts on general health topics and enjoying your retirement and all these great tips on how to get a physician's appointment, which is getting harder and harder to do. She has incredibly thick hair. And so she never missed a beat in terms of getting thinner hair, like a lot of women do after pregnancy or with menopause or after surgery or some sort of stressors. So, what are some of the causes of hair thinning? If you notice more than 150 hairs shed per day, usually most people lose about 100 hairs to 120 hairs per day. If it's definitely more than that, it's time to be evaluated by either a physician or a specially trained advanced practice clinician like a certified nurse practitioner, CNP, or a PA, a physician assistant, who is sensitive to your concerns. Now, many times the hair thinning is just transitory from what we term telogen effluvium, which occurs when the resting and growing phases of the hair are out of sync. Nutritional deficiencies are big causes of hair thinning. And if you are low in iron stores, that contributes to hair loss. You need a ferritin, which is a measure of iron stores, although it can be falsely elevated from inflammation. But assuming you're at steady state and you're not inflamed, it should be at least 50 to 70.
We'll be back after a quick break.
Are you anxious about aging in the home? I know I am. For myself and for family members who need or will need care in the home. I've put together an informal podcast where I ask the owner of a home care company, her nursing leaders, and a variety of guests about how caregiving works in the home so that people can stay in their homes longer. We talk about everything from innovative thinking to basic tips in a conversational style that is optimistic. The podcast is called Keep Me Home Longer. Click on the link in the show notes or search for the podcast name, Keep Me Home Longer.
If you didn't listen to my very first podcast ever on iron, that's a great one to go back to listen to. Now, low zinc levels under 60 are another contributing factor for hair loss. Vitamin D. Oh, vitamin D is like the miracle vitamin. That's not even a vitamin. It's a prosteryl hormone. That was podcast 3 of episode 1. And optimal levels recently have been shown research-wise to be 75 for hair growth. So for a long time, I was just trying to keep my patients' vitamin D levels over 32 for bone health to prevent secondary hyperparathyroidism. And then more and more research came in with reducing several cancers and immunologic problems and COVID lung. And I pushed it up to 50 to 60 for most of my patients. But the latest research with hair is 75. And one meta-analysis recently that was just published in 2024 looked at several published studies and meta-analysis of vitamin D and concluded that high levels of vitamin D were very protective against hospitalization for respiratory infections such as COVID. So we certainly don't want you toxic on vitamins, particularly vitamin A is a real vitamin, and just 2 times the recommended daily allowance is toxic. But some of the RDAs on some of our vitamins are just like the bare minimum to prevent overt deficiency. It's not necessarily optimal, and each vitamin has quite a range depending on which vitamin it is. And some vitamins like folate are very short acting, unless you're on the optimized folic acid, L-methylfolate or levomefolate. And if you haven't listened to the podcast I did on the mind and the mind diet and optimizing brain health, we talk a little bit about those differences in those methylated vitamins. Many vitamins like the B complex vitamins are water soluble. So extra vitamins are generally urinated out. Some are fat soluble, and vitamin D is fat soluble in that it does need to saturate all the fat stores. So persons that are overweight or medically obese can sometimes take a lot more vitamin D to saturate their levels. But it's not toxic to the liver in the way that true vitamin A is toxic at just twice the RDA. Now, getting back to nutrition, it's not just vitamins and minerals that are important for hair growth. quality protein, good quality protein. If someone has been losing weight, is malnourished, has had a lot of medical stressors, surgery, any catabolic state that requires the body to be under stress and undergo repair, preferentially the hair and the nails are going to be the last thing to be serviced in the body. So there's lots of fad diets, sometimes people that are strict vegans that aren't getting complete proteins can notice more issues. And low vitamin E levels and other trace mineral deficiencies can also contribute to hair loss. There are certainly medications, most notably chemotherapy, whereas some medicines promote hair growth, like oral and topical minoxidil. And topical high potency minoxidil, one of the brand names was Rogaine High Potency Foam, which is now over the counter. It used to be prescription only. And oral minoxidil in higher doses used to be used for hypertension until it was found to be growing hair, like on the face and other places. But I do see our dermatologists use very low doses, like 2.5 milligrams, which really are not blood pressure medicine levels, but enough to help stimulate hair growth. Now, autoimmune conditions are more common in women, and scarring alopecia can occur. Many times it's on the sides. And I have a number of patients with this condition, and I don't even know it until they tell me and pull the hair back on the part line. So fortunately, women can have much longer hair if they want and do different styles if they're able to grow it out. And many styling tips can help women with their hair and men as well too. Now, alopecia areata can cause circular patches of just complete absence of hair. It's another autoimmune condition that really should be evaluated and treated by a trained dermatologist. Now, not all dermatologists are interested and trained in hair and nails. Many are, but not all. Just like I tell women, just because you see an OBGYN, they may be primarily an obstetrician and not a midlife gynecologist. Or they may be a very subspecialized gynecologic surgeon, and they're not going to deal with medical and preventive issues. So it's the same in dermatology. Now, as far as female patterned hair loss, 90% is genetic, and we cannot change your genes. 10% is hormonal. So I have a 10% area to work in. So if you are predisposed to this and you know your family history, and you know inevitably you will be in menopause at some point if you live long enough, which thankfully most women do, estrogen levels go from pretty good levels to completely plummeting off just right off the cliff. And this can further unmask the androgen-driven hair thinning because the androgens still get made in the ovarian stroma and the adrenal glands, even when there's no more female eggs left. So that really flips the ratio. Postmenopausal estrogen therapy, particularly oral, is beneficial to the skin and hair because it drops androgen levels. When you swallow something by mouth, it goes to the stomach and liver, and the liver makes proteins which glom onto the androgens. So it not only raises estrogen, but reduces the androgens. Now, transdermal estrogen is still very helpful for the hair because you're getting natural bioidentical estrogen through the skin, and you can measure it in the bloodstream. Now, like with any situation, cosmetic and certainly otherwise, we all need to optimize our health habits and our diet and nutrition before spending hundreds of dollars on products that may or may not be helpful to you. And a word of caution, and this includes even women that aren't bothered with hair thinning, is that many vitamins and hair care vitamins that may not even be listed as hair care or skin and nails contain biotin. Biotin is B7, and it really may or may not really help the hair. I think it helps the nails more, but it interferes with lots of blood tests, hormone labs, thyroid labs, estrogen labs, cardiac testing. In general, you're supposed to avoid taking a biotin vitamin at least 12 hours, preferably 72 hours before blood work. And so many of my patients who take vitamins, they don't even realize they're on biotin, and they call Nurse Alexandria or my charter and say, "Oh, I just got home and I finally looked at what I was on, and even though I had my blood work, I was really on a good dose of biotin. So I think I should have my blood work rechecked." So please check that in advance and just make a habit of bringing in your prescriptions and your supplements, not pictures, the actual bottles. You need to look at the expiration date, the lot number, where it's manufactured, what are the listed ingredients. And there's also inert ingredients. Could be gluten, and maybe you have celiac disease. Now, gelatin capsules, I do recommend a lot more generously, and collagen as well, because as well as increasing protein in your diet, because I think that really helps both the hair and the nails and doesn't interfere with blood work. You may want to ask your physician for their recommendations on what you might want to consider taking. And you have been listening to the Speaking of Women's Health podcast, and I am your host back in the Sunflower House, Dr. Holly Thacker, for this Father's Day 2024, where I am saluting fathers and all the father figures, my wonderful husband, Tom, fabulous father to our 3 grown sons, my 2 older sons, and my soon-to-be 4th son, nephew, Keaton, who's soon to be a father. And all those fathers out there that our listeners hold dear. So getting back to asking your physicians about recommendations, our dermatology group has a small shop in our cryo building, and it's staffed by some of our terrific, fabulous skincare estheticians. They've written columns on our website, and you've heard me interview them on this podcast on skin and skincare products and different types of fun facials that are medical grade. Well, they also offer not just medical grade skin products, but also some hair care vitamins. And I think before you spend a lot of money, it's really good to get recommendations from your own personal physician or dermatologist as to what expensive hair care vitamins might be worth trying. So, one of the brands that I was talking to our skincare estheticians about is Votesse, Votesse, and it's a hair vitamin complex that does not contain biotin B7. So I'm happy about that because I order a lot of blood work. But it does contain vitamins and trace minerals, just a little bit of iron, 0.8 milligrams, and 10 milligrams of zinc, which is about the recommended daily allowance, 8 to 11 milligrams. And if you haven't been on our speakingofwomenshealth.com website, we list all these zinc-rich foods, and it's not just oysters. B-complex vitamins, ashwagandha root extract, which is something that a lot of the functional medicine doctors use to reduce adrenal stress. And this one also contains a probiotic hormone. And the dose is 2 capsules twice a day. So when you look at the bottle to see what percent of what ingredients are on it, you need to look at how many capsules and figure out, are you taking that number? And then look at your other vitamins, because a lot of my patients, they don't add up, oh, I'm taking this, but then I'm taking this, which is a duplicate. And that's why I like people to bring in their supplements and prescriptions. Another option is Nutrafol, Nutrafol. And it's a hair vitamin complex with different formulations for different people. There's a premenopausal type, a postmenopausal one, and the Nutrafol family does contain a hefty dose of biotin, 2,500 milligrams, and that's definitely enough to interfere with laboratory testing. It's not the 300 microgram kind of, recommended daily allowance. And by the way, there are a lot of foods that have biotin in them and pantothenic acid, also good for the hair. So the postmenopausal version for women past childbearing, it contains the herb saw palmetto. And saw palmetto is sometimes used by men who have enlarged prostates because it blocks androgens effects on the prostate as well as the skin and hair. And so some dermatologists recommend this for women with androgenic hair thinning, as well as some plastic surgeons recommend it for women as well with skin issues, particularly if they're having issues like acne. There's nothing more frustrating to a midlife woman is to be getting acne when she didn't even necessarily have it as a teenager and wrinkles at the same time. That's very exasperating. Now, the premenopausal version does not contain saw palmetto because premenopausal women have plenty of estrogen. And of course, you can be a postmenopausal woman with plenty of estrogen if you're on hormone therapy. And the women with hysterectomies get to take a little more estrogen because when you have a uterus, we have to be a little stingier because more estrogen will cause uterine bleeding. Now, this one of the vitamin complexes of Nutrafol contains 20 milligrams of zinc. Now, I frequently get zinc levels if there's hair thinning, fatigue, depression, and I find a lot of low zinc levels. And I don't know if that's because people are trying to avoid meat or they're getting too much processed foods or on fad diets, but I usually recommend if you're low, 25 to 50 milligrams of zinc, but only short term to boost the levels, and then go back to 10 to generally no more than 20 milligrams. And Nutrafol also contains vitamin E and vitamin A. And it's at 167% vitamin A of the RDA. And as I mentioned, we don't want anything even close to 200% or twofold for vitamin A, especially for women who can become pregnant, because it can have negative effects on the pregnant woman's baby, the fetus. And if you're eating foods like a bag of carrots or pumpkin or orange or yellow colored vegetables and fruits, you're probably already getting enough vitamin A. So you got to know what your diet is and all your supplements. So I don't generally like people on this for more than a few months until they're reevaluated. This Nutrafol blend also contains amino acids, collagen, resveratrol, liposomal curcumin, which is an anti-inflammatory, and when it's mixed with piperazine or pepper or it's liposomal, it's better absorbed. And it also has twice the recommended daily allowance of selenium, an antioxidant. And it also has fish components. So if you're allergic or anaphylactic to fish, again, it's another important reason to really read all the ingredients. I think a lot of people think because something's over the counter, it's just safe and they can take it and not really pay attention. But whether something is prescription or over the counter, you need to treat it with the exact same care and alertness. Now, long term, I don't like people to take too much selenium or chromium because what is an antioxidant can become a pro-oxidant. So this is also 4 capsules daily. And as a physician in general, not that I'm giving you medical advice unless you come see me, but I think a general recommendation to not take for more than 4 to 6 months straight without being evaluated by a physician or a healthcare professional who's expert in this area is really a good thing to do because there are a lot of substances in this. Now, there may be some people who really need it. They've been stressed. They had major surgery. They had a child. They were thrown into early menopause. I mean, there can be a lot of different reasons that you need to be boosted up. The first thing I boost up is just the general diet and the lifestyle and the vitamin D. And if the iron is low and the woman's over 40, even if she has heavy periods or has had lots of children and breastfed and done other things that really drain your iron, my radar goes off immediately for occult GI blood loss or occult tumors. And I have diagnosed many a person and potentially saved their life by diagnosing early cancer or early precancer by putting my foot down and saying, this iron is too low. Even if you're a blood donor, even if you previously had heavy periods, if it seems, even if it's partially explainable, but you're over 40 and you have not been evaluated with the increased risk of colorectal cancer we're seeing. And if you didn't listen to my March podcast on colorectal cancer, please go back and listen to that. So getting back to the Nutrafol, there are 4 types. Nutrafol Woman, there's a woman's vegan for ages 18 to 44 in general. The Nutrafol Woman's Balance is the 45 plus perimenopausal menopausal one. And there's a Nutrafol Postpartum. I know we've got some women listening that are young moms or moms to be. And the postpartum one contains 3,000 milligrams of biotin. So that clearly interferes with lab work unless you're off of it for 3 days. And it has 15 milligrams of zinc. It also has omega-3 fatty acids. And if you haven't listened to my podcast in season 1 about should you take omega-3 capsules or should you just eat foods that have omega-3, that's a good one to listen to. It also has fish shatavari extract and some other substances like nettle root and pea sprout extract and sea buckthorn powder. It's kind of a mouthful. There's also a Nutrafol for men. And whether you're a dad or not, if you're a man with hair thinning, this Nutrafol Men has the highest concentration of saw palmetto. Now, many of the hair vitamins do contain horsetail extract, which is silica, which seems important for collagen and might support hair strength and hair shine and scalp health. And the health of your scalp, your skin, is very important. If you have dandruff, you should see a dermatologist. You might need a zinc-based shampoo. If you have psoriasis of the scalp, other dermatitis that can affect the scalp, it's really important to see a dermatologist. Now, over-the-counter hair vitamin options. I think that topical minoxidil, the high-potency 5% foam, we like the foam because we want it to stay where you put it. We don't want it dripping down the face. I put minoxidil on a Q-tip and put it on the lateral aspects of my eyebrow where they don't seem to grow as well. And hair does grow where it goes, so it has to be very specific. Revitalash, that's an over-the-counter product. I've bought it in our skincare esthetician's little shop, and it contains topical peptides, biotin, topical biotin, and conditioners. Now, topical castor oil and rosemary oil have also been used topically for eyelashes and eyebrows, as well as on the top of the scalp. I tried some rosemary oil on my scalp. I can't really say I thought it made much of a difference, but it smelled nice. Prescription products. Well, there is topical liquid by Modapost, which is also goes by the brand name Latisse. You probably see the eyelash advertisements. And it can be applied right to the lash line. It is used to treat glaucoma. And if you're a lighter-eyed person, it can really darken your eyes. So this really, I think, should only be prescribed by an ophthalmologist, not a general non-eye physician. Now, aldactone, brand name spironolactone, is a potassium-sparing diuretic that has an interesting effect on blocking dihydrotestosterone, which is the active testosterone, and the DHT is what affects the hair follicle. And this can be used orally as long as there's not renal failure or the person's not on other medicines that will raise potassium. Oral minoxidil in low doses is sometimes prescribed by dermatologists. Off-label Proscar finasteride is also sometimes prescribed. This is generally a medicine for men with big prostates. Propecia is finasteride, but instead of a 5 milligram dose, it's just the 1 milligram dose. And that has been FDA approved for men with male patterned alopecia, but I do see dermatologists prescribing it to some sensitive women. Now, there's other dermatologic options. Laser hair caps, combs, bands. If you're going to buy one, they're expensive. Look for a money back guarantee. Some hair dermatologists offer PRP, plasma-rich, platelet-rich plasma. So they draw off blood, spin it down, get the platelets in the plasma that are very rich with growth hormones, and then they do scalp injections. This is cash pay, insurance doesn't cover it, and needs to be provided by a dermatologist expert in this area. Now, not everything hair care has to be at all medical. I mean, there's tips and tricks and therapies for women who have thinner hair. And so while I can prescribe hormone therapy and guide and evaluate and treat vitamin deficiencies, I am not trained in beauty or cosmetology. And for men who have male pattern hair thinning, many of them just shave their heads and they go with that masculine cue ball look. And some women can really wear that cue ball look fabulously, but it's a little harder to do, I think, as a woman. So my patients have actually taught me some clever tricks that I've been able to share with other women who suffer from hair thinning and it bothers them. Because again, it has to bother you. Just like on our podcast where we talk about low sex drive, someone may have a low sex drive, but if it doesn't bother them, it's not a medical problem. If it bothers them and it's causing problems in their life, then it needs to be assessed. So styling tips. Well, if you have a hair color that's approximately the same color as your scalp, then you don't see that scalp. There are shampoos that contain silicone to coat that thin hair and thicken up the appearance of the mane. I really personally like to use some of those silicone-based shampoos. And using a very clever product that comes in all different hair colors, it's called Topic. It's put on the hair and scalp line to make the hair look instantly thicker. I also have some patients and friends that they don't necessarily have any hair thinning, but they may have very nice dark hair, but their line, the skunk line, or the hair grows in white or gray, and they don't want to necessarily keep going back all the time for coloring, and they may just put that Topic powder on, and it gives them a little bit more time before they have to go and have their hair colored. I think it can be fun to experiment with wigs or hair pieces or hair extensions. They make some interesting detachable hair extensions and hair bands. Also, just wearing very stylish hats. I have some friends that aren't really blessed with the most amount of hair and they really like to rock the hats. And it also gives them a little sun protection on their face as well. So I think it's good to kind of look at least the sun is half shining or the glass is half full, and not be too downtrodden about the fact that your hair isn't like you would exactly like it or it's not like it used to be. Because that's part of growing with some wisdom and kind of accepting the different stages in life. But rather than just give into it right off the bat, especially if you know there's this family history, getting ahead of menopause and perimenopause, I'm very interested in, not so much for the cosmesis part, although that's always a bonus for we women, but because women who are hormonally deficient, who take hormone therapy, generally function better and live longer. And so that's a huge bonus from my medical perspective. So as we're wrapping up, when should you see a dermatologist that specializes in hair loss? Well, certainly if it's rapid or patchy or associated with other symptoms or rashes. If you're experiencing excessive hair shedding when you've already been assessed for all the vitamin deficiencies and hormonal imbalances, you've already worked to improve your diet and exercise, you've controlled your stressors, you have documented more than 150 hairs shed per day, and a family history of androgen hair thinning or a family history of autoimmune conditions. If you're interested in pursuing out-of-pocket hair therapies such as PRP, or even sometimes hair transplants are done. If your primary care physician thinks you may need a scalp biopsy. So ladies, I can't change the genetics that you inherited from dear old dad and dear old mom, but there are medical and cosmetic options that are available to help you feel good and look good. And having confidence is an important part of being strong and healthy and in charge. And strength needs to be fostered in everyone. And many fathers really help develop strength, fortitude, and confidence. Cheers to all those devoted dads who've helped their children be strong and be healthy and grow up to be in charge. Happy Father's Day. If you enjoyed this podcast, share it with others. Give us a 5-star rating. You can go on our site and donate to speakingofwomenshealth.com, our nonprofit. And join us next time in the Sunflower House.